Hello and Assalamu alaikum. Welcome to another episode of Health is Wealth. I am your host, Shabnum Riaz. Today we have a really interesting program for you. We are here at Aesthetics. We're going to talk to Dr. Fatima Ahmed, and she is going to tell us about aesthetics. She's going to tell us about a really interesting concept, which is IV mineral and vitamin therapy, or IV cocktails, and what this does for your health. Why do you need it? What are the nutrients? What are the vitamins? What are the minerals that we may be lacking in? And how we can get this done by just having an infusion at regular times in the month or maybe in the week. So let's go and talk to her and get all the information that we need on this really exciting program. Come with me. And as I said, today's program is very, very interesting. So here we're sitting down next to Dr. Fatima. Dr. Fatima, thank you so much for giving us the time and inviting us here to your clinic.
Thank you so much for hosting me today, and it's a really big pleasure, I would say, just opening up something new and then just getting so much attention right away.
Well, that's your good luck.
Thank you so much, I know.
And I'm sure that, you know, once we have today's discussion and we talk about today's topic, which I explained in the introduction to our viewers, they will be intrigued to find out more. And before we go on any further, I'd like to compliment you on the way you've set up your clinic downstairs. The aesthetics are beautiful.
Thank you so much.
And everything looks wonderful. So I think what happens is the patient walks in and already they feel more calm and zen.
Yes, exactly. That's the whole thing that we're supposed to look forward to. Like when you're coming in, and aesthetic is all about beauty. It's about calming. It's about looking good. So if in case you step into a place which is looking nice already, the aesthetics are pleasant, you definitely feel good before even getting the treatment done.
That's true.
Yes.
Absolutely. Absolutely. So as we're talking about the IV infusions and the IV cocktail therapy that we're talking about, for many people it's going to be a new term. They won't know exactly what it is. So if you could just explain to our viewers, what is IV treatment using vitamins and minerals and other sorts of you know, chemicals that you guys use.
So honestly, I would say nowadays the trend is more like beautification is on the trend, right? Me coming back from a surgery background, I kind of feel like, you know, I would definitely love to do procedures first, right? And it's actually I'm gonna make good money out of it too. But when you are a doctor and you need to first practice whatever the body system is like, right? So when someone actually walks into the clinic, I would not recommend them to do any kind of topical treatments right away. Instead, I will ask them to do some blood work first. I would want to see what's going on in their system. I want to learn how their body works with certain things, right? So if in case some people, they have a lot of stress, some have hormonal issues, some have any kind of metabolic issues, all of that is happening already. Me presenting any kind of topical treatment, let's say lasers, PRPs, all of that, is not going to be 100% efficient on their skin, and it would not give me good results, which will actually end up them not trusting me or my techniques enough. So what I do is initially start off with your whole blood work, see what's going on in your system, what kind of vitamins you're deficient in, do you need an energy booster, an immune booster, all of that is in check first. And with that, I make a combination treatment where I would say now you can actually get some kind of topical treatments done. So IV vitamins or IV antioxidants and all of that is more like a person comes in and says, I feel lethargic, I have a lot of breakouts happening, I feel like, you know, I have body aches and pains, and I kind of feel like my skin is getting dull, and I'm hydrating myself enough, but I think it's not enough. So I would definitely want to see what their serum electrolytes are like, right? If they're hydrating, are they taking any kind of electrolytes, minerals or vitamins along with that or not, right? Plus also if their HB level is very low, which definitely puts a very big impression on your fatigue. Also the cells kind of do not have enough blood in there, so the cells kind of shrink, and when they shrink your face looks really dull. You have fine lines and wrinkles coming in really soon. So if in case you actually get those in check and then you do like a course, so we offer different cocktails and then there are customized cocktails. So as I say, if in case you have different deficiencies according to your blood work, we actually give you customized cocktails and which is infused into your IV in your veins.
Right.
So when they're infused, what happens is that orally if you take some vitamins or minerals, right, what happens is that it breaks down in your gut, then your liver processes it, then it is absorbed by your digestive systems, right? So what happens is it goes through a process where it breaks down so many times that by the time it absorbs into your blood, it's half of the efficacy left, right?
So you're losing about 50%.
Exactly, you're losing it. Also, if anyone's compliance is not good enough, every time you ask them, oh, I missed today, I'm going to take it tomorrow.
Oh, that's true.
Every time it happens, right? We're very tired, we're like, oh, I missed it, right? I'm going to take it tomorrow. But you're missing on the doses also. Your body requires a natural dose every day. Right? Okay. Once you miss a dose, it is not going to compensate for tomorrow.
And this is to keep up with the bodily functions
exactly.
that are going on all the
yes,
time.
Yes, because you're waking up every day, you're working every day, your routine is the same, but your deficiencies goes down and down and down because you're missing one dose here, one dose there, one dose here. So you need to keep up with that. What happens with the IV is once you get it infused into your blood, there's no downtime, it absorbs right there then. It's in your blood.
100%.
100%, right? So you see results right away, right? And then you actually feel that it's actually changing something into your body. Let's just say, for example, if you take glutathione, vitamin C, and zinc together, that is the best antioxidant cocktail that we have. So what happens is that it has a lot of pros when it comes down to the benefits of it. Let's say it actually releases all the free radicals of your body. So free radicals, if someone doesn't know, is actually the amount of stress that your body takes. It kind of just like, you know, brings up the free radicals level in your body. So your cells gets affected, your sleep get affected, your digestion gets affected, like all the patterns kind of just like get affected. So with antioxidants, they flush out all the free radicals of your body. So when it's all flushed out, your digestive system is fine, you sleep very well, you feel more energetic, your skin gets brighter, gets more plump. So that kind of helps a lot.
So this is really, really interesting.
Yeah.
You see, because Dr. Fatima, what's happening is that you are taking this as another approach.
Yeah.
You get patients who come in and, you know, they want to talk to you aesthetics-wise.
Yeah.
And first of all, you're going through their blood work,
Yeah.
which is, you know, a very, very important aspect.
Yes.
And not every doctor is going to be doing that. So that's fabulous.
Yeah.
So we were talking about glutathione. I always get that one wrong.
Yeah, that's fine. Yeah.
So that is also a sort of a brightening agent, is it not? And many people are using that so to brighten their complexion.
Yes.
Can you throw some light on exactly the role it plays? It does not exactly change your skin tone.
True.
But
true. So what happens is that, let's just say glutathione basically came out as a really strong antioxidant for patients who actually have liver diseases or patients who can't really, like, you know, just eliminate all the free radicals of their body, right? And what happened is that people kind of got to know that if in case, so initially it was actually, let's just say initially when it came out, right, it was basically a side effect of a drug, right, when cancer patients were getting treated. What happened that people actually kind of got to know that the higher the dose of the glutathione is, it might actually lead to whitening of my skin, right? And of course, being in Pakistan, the normal is brighter and whiter, the skin tone is, the more elegant, the more fresh you look and stuff. But then again, I need to actually cut it down right now because it's not a whitening agent, it's a brightening agent.
Right.
Right. So when I say brightening, brightening doesn't really mean it's actually going to increase, you know, the tone of your complexion. It's not going to just like, you know, make you fairer. It's going to make you look brighter more fresher, more youthful, I would say. Why? Because when you have two-tone discoloration on your face, right?
Which many people do of our
everyone,
origin.
exactly.
Yes,
Everyone
South
does.
Asian origin.
There's a lot of melasma problems everywhere around in the nation, right? Mostly Asian people, they actually have a melasma problem, right?
Yeah.
They don't put nice sunblock on, they're very dull with their skincare and stuff. But then again, I would say if in case you are really consistent on your skincare, right?
Yeah.
Plus, if in case you actually get your blood work done and ingest glutathione in the right way with the combination of vitamin C, because vitamin C is a brightening agent also, right? It kinda is very beneficial then. So I think glutathione doesn't really only brighten your skin, it detoxifies your liver, it gives you a really fresh look. Why? Because it kind of just like eliminates all the free radicals, right? It improves your cardiovascular system if in case we add zinc and biotin to it. Plus also, let's just suppose say that you have, let's suppose you have some kind of ulcerative colitis. This is a metabolic process problem, right? You have Crohn's disease, right? You have any kind of gut indigestion problems. What happens is that in those treatments, when you actually take oral medication, your gut is not absorbing them. The gut layer, the absorbing cells are actually diminished. So people will actually get prescribed those kind of medication, but it will not affect. But
so they're taking the medicines and they're wondering why isn't this working?
Yes, and then
because they have absorption problems.
Exactly. Right. Plus also what happens is that it's also a load on the liver, because the liver has to break down all the drugs going through, right? So your ALT, which is like, you know, an essential
liver enzyme.
Liver enzyme, it increases and increasing because the load on the liver increases. But it is not giving you the efficacy that the product needs to give you.
So this actually helps with deranged liver enzymes as well, and fatty liver.
Yes,
so that's also something that's very important for people who have that issue. It's, you know, discuss this with your doctor. And, if it's possible for you, you can also consult with Dr. Fatima here, who can give you a complete rundown on exactly what it is that you need. You also mentioned something when we were chatting earlier about menopause.
Yes.
Does that have a role there as well?
So when we say that we are offering cocktails, so we don't really offer cocktails according to the patient's need. We also assess the patient first. Let's suppose gender-based, weight-based, according to the oxidation levels of the person, like, you know, how stressful his or her routine is.
And age, does age?
And age, right? So what happens is that if in case we actually put them in terms, so ladies in the initial phases, right, don't really need that much of minerals and vitamins in their body, because you know what, the hormonal level is so good. Our hormones are actually producing everything for the body and everything is in check and balance, right? So what happens is that when menopause hits in, your hormone levels derange, right? That is the essential investigation we also do for, like, you know, patients above 40 years and 50 years. So what happens is that we have this Myers cocktail, which is like a really nice cocktail. In that, what we do is we keep a check and balance on all the vitamins regarding the menopause. There's a vitamin B complex, the zinc, magnesium, right? And also we offer glutathione with it. So we make a whole cocktail for those patients, because once your hormone goes down, your knees, your joints, your every joint kind of starts aches and pains.
Your nervous system as well.
Kind of deranges a little. You have mental problems, So we do have, like, you know, where we actually kind of add up that and make a cocktail for the menopausal ladies. And it is so efficient, I would say, that, you know what, if you actually have it like twice, you feel the difference already. And then people actually want to come in for that again. Why? Because they're like, you know, I feel so energetic. I feel like I'm back in my 40s and 30s again. I can just like go and work out again. So that is, I mean, like when you actually get all that feedback from a person, it makes you happier.
You realize exactly how much of a difference it's actually making. And I would think that these things are, you know, those aspects of our health that are not discussed. Unfortunately, when we talk about women and especially menopause, I mean, this is something that is recognized worldwide, that this is not talked about enough.
Not at all, exactly.
That we're not having this conversation. And in fact, women of, you know, a certain age, when they get to menopause, then life becomes so hard for them because they don't know what's going on. They don't understand.
Just like postpartum hemorrhage, right? Postpartum diseases are actually like the disease that people don't talk about. So even in postpartum, what we do is that we kind of counteract the whole system. So depression is also, I didn't talk about depression, but depression is also one of the main cause of, let's say, dehydration or any kind of decrease in your vitamins in your body. How do you get depressed? Depressed is like, you know, what main cause for depression is dehydration, I would say, right?
Dehydration?
Dehydration actually causes depression too.
Oh, I didn't know that.
I will tell you, like, the system goes on. Yes, the system goes on. Like, so water is a very essential component of the body, as you know, right?
Yeah.
What happens is that the lesser the amount of water in your cells starts shrinking.
Okay.
So when your cells shrink, there's not enough water in your cells, right? What does a brain cell actually, or let's say blood cell, brain cell, whatever, right? It actually needs to be hydrated to function properly, right? So when you get dehydrated, have you noticed, like summer is in already, right?
Yeah.
Have you not noticed when you're dehydrated, you're very irritable, right?
And you get a headache.
You get a headache,
Yeah.
you get nausea, you don't feel like eating anything until you're hydrated enough, right? You've seen people who actually are dehydrated after a diarrhea episode or a GI episode, right?
Yeah.
When you have gastrointestinal infection or something like that, what happens is that you get dehydrated. When you're dehydrated, you're bedridden, you don't have the energy, you have nausea, you're very irritable, anything and everything kind of just like, agitates you so much, right? If it stays for long, the dehydration, it starts depressing you because you're ill for the longest. You're not recovering, right? If you're not recovering, you're like, what's happening to my body? And you're not keeping a check whether you are hydrated enough with the right electrolytes important for your body. That's when we infuse the ringer lactate.
So hydration is not just about the water, the electrolytes
and
as
the electrolytes
well.
as well, exactly.
Okay,
Yeah, there should be a balance between the
Right.
water and the electrolytes, right?
What are the signs of dehydration?
So the first sign of dehydration is fatigue.
Okay.
You fatigue, really fatigue. You kind of feel like you don't have any energy at all because all your cells in the body have shrunk down. So when they shrink down, right, the muscle doesn't get enough supply and the muscle kind of just gets fatigued, right?
Okay.
So your muscles don't function properly. Second, your face looks really tired. You have like fine lines and wrinkles on your face already. Thirdly, nausea is the biggest complaint, right? When you notice that whenever you actually are dehydrated, you feel nauseous and people are like, you know what, give him some salt and water in a glass, right? And it just acts up really well. What is that? Electrolytes together. Sodium, right? Sodium in water and then some sugar because
Sugar
for
as
the
well.
glucose, right?
Yeah,
So
right.
sugar and salt together, the sodium and the glucose, with the perfect amount of water. What is that? Electrolytes and water together. You drink that glass of water, you feel fine then, right? So for those kind of people, what we offer is like, we put some kind of anti-nauseous medication,
Okay.
the perfect blend of electrolytes and the amount of water required for how much the patient is dehydrated, whether they need 500 ml, 1000 ml amount of water, right? So we make a carton for that and the dehydration just goes away. So that's the benefit of IV because maybe you're so nauseous, even if you drink a glass of water, you throw up, right? When you're not feeling well, you even throw up water.
Yeah.
So putting it in your system right away, it just goes in. Whether you want it or you don't want it in your gut, it's in your system now. And your
Right.
system starts functioning again.
So in our country where the summer gets really
Really hot, yes.
how much do you suggest that a person, how many glasses of water or how much water should we be drinking?
So normally, I mean, like, as they say by the book, right? 3 liters of water is essential. Yes, by the book, I would say. So that is essential. Why? Because the thing is that every cell gets to get hydrated enough, right? But of course, the consumption is very less because nowadays life is so busy. Plus also you want to eat all those junk food out
And
there.
not only that, so many people instead of just having regular water, it seems boring to them.
Yes,
so they're having
yes,
juices,
yes.
and not even proper juices. They're
Yes.
having the
the sodas
store-bought,
and all
the
that.
processed,
Yes, exactly.
and
That's
these-
really bad
yeah.
for the system. They kind of feel like, okay, that's some liquid in my body, but it's not adding anything to it, right?
In
People
fact,
kind of
it's
think-
causing more of a problem.
More problem. Why?
Yeah.
Because what happens is that it kind of saturates. So in your body, when you're actually having sodas or any kind of other drinks, what happens? It saturates even more into your blood. So when your blood is more saturated in chemicals or more electrolytes, right? So that's also a good balance that you have to keep when you're giving IV, right? If you're giving a lot of the electrolytes, the vitamins, right, and lesser of the water, one of the cons of the IV is also this, that it's actually, by the book, they say it becomes an expensive pee, right? Your urine becomes more expensive,
I
right?
read that somewhere.
Yeah. So what happens is that, you know what, because you're actually not balancing it properly. There needs to be a proper balance of water and electrolytes or the vitamins in your system.
Right.
That's how it's going to be processed properly and your pee is going to be like diluted enough, right?
Right.
Or otherwise your urine is actually super saturated and that's called the expensive pee, right?
Okay. In these days of inflation, where people are worried about
Yeah,
finances
true.
and things being expensive,
Yes.
I would think that many people would have this concern
Yes.
to know whether this is affordable. I mean, there are so many people who are taking supplements
Yes.
in vitamins. Many people get their vitamins from abroad.
Yes.
So that also costs a lot of money.
True.
You're getting them here as well. I mean, they're still expensive.
Yes.
How does this figure out in terms of financial expenses?
Okay, so I wouldn't say that it's cheap. Okay, I wouldn't say it is economical. I wouldn't put it in that category, right? But let's just say if in case we compare orals and IVs, right? Then I think it is actually affordable, because if someone is investing, so let's suppose if there's a person who's not investing anything into oral vitamins and minerals, right? And then they ask me how much sessions am I supposed to take, or am I supposed to take an IV customized, or like, you know, whatever is required by my body. For them, it kind of feels like, you know, we start our package from 15,000, right? So what is that and then if in case we actually have customized, we go like 20,000, and if you actually want to have cocktails 2 together, then we do it according to that, right?
Okay.
So, and then also depending on how much your body needs, if you're really low on, let's say, vitamin D or your calcium levels or whatever, right? So we actually plan it accordingly, and then of course it's actually priced accordingly. But I would say, when we put in comparison the orals and the IVs, right? Yeah. It is almost the same, unless I would say it's actually lesser than the oral, right? Why? Because what happens is that when you're taking an oral vitamin, you're purchasing a different vitamin every time you go to a store, right? Every vitamin that you purchase, 5,000 and above, right? You are purchasing a different vitamin, and then you have to take like a chunk of pills altogether, right? It gives you more nausea also, because you know, it takes a while in your gut, and then it absorbs down. So then you kind of miss on it too, right? So there's a whole lot of bottles right next to your bedside. I mean, like, I have it too, right? There are certain oral vitamins that I actually take. So you have it by your bedside, and then you feel like, okay, I'm going to take these, and it's actually nice for me. And then it's like, you know, cheaper. Why? Because I'm taking 1 bottle and 2 bottles and 3 bottles at a different price,
so
right?
you think that you're...
Yeah. So when you add it up together, it's actually very costly.
Yeah.
It's about, let's just say it's about 30,000 or so, right? And that too with less efficacy. Right?
Less absorption, as you said. I mean, that is the main thing.
Yes, and then
you're doing something, but it isn't actually helping you as much as it could.
Yeah, so it's actually more costly. And compared to that, if you're taking a vitamin or any kind of cocktail within 15,000 rupees, right? What happens is that it lasts longer for, let's suppose, 2-3 weeks, right? Just one cocktail actually lasts that long, right? And then you don't really have to frequently take the cocktails. That is like, you know, a multivitamin cocktail. You have to just take it like once a month maybe, right? Other than the required cocktails that your body needs. So you take that weekly, or maybe like alternate weeks. We actually just like, you know, compare that to the body's need. So I would say economically, I would say it just ticks the box of economic.
Right.
Yes.
It's
affordable.
It's affordable.
Yes.
If you look at it logically, and you look at it as compared to the vitamins or minerals that you may be taking orally. Okay. How about women who are pregnant? Can it help them if they're having a problem in diet, eating, or whatever? Can it help them?
Yes, of course. So what happens is that you've seen already that, you know, what the biggest problem when you're expecting is nausea. Right? You hardly want to eat anything, right? And your nutrition level goes down, and you have to keep a check on the nutrition, because if you don't really have that nutrition in check, your baby's getting affected. Just for that sake, mothers can't just like, you know, ingest so many things, they throw up again, but they still eat, right? So that is actually giving them a lot more complications. So I would say, so there are certain things that we do not prescribe in the first trimester, right? Certain amounts of like calcium, magnesium and all that, because they actually work on the contraction and dilation of the blood vessels. So you can actually, if someone is having a blood pressure issue, high blood pressure, or some kind of cardiac diseases, so we keep a check on the calcium and magnesium in the solution, because we don't want the blood pressure to elevate too much or decrease too much. Other than that, actually helps basically for cardiac patients when they have high blood pressure. The calcium and magnesium check on balance of both actually dilates the arteries enough that the blood pressure decreases, right? So it's actually beneficial for them. But as I said, for pregnant ladies, first trimester, we're very careful with what we are actually going to treat them with. But it is very beneficial second trimester and onwards. The vitamin D levels are in check, the calcium levels are in check, the HB level is the main problem here, right? Most of the pregnant ladies actually have lower HB, and because of that, they have anemia. Right after they deliver, they have anemia, which is like, you know, like low blood levels. So we keep a check on that. There's like a drug we actually add to it, and then it kind of keeps up with that. Plus also the hydration. We keep a check on the hydration of the patient, because they can't just like throw up every time and then they don't have enough in their system. So it helps them in various ways, but let's just say we're very cautious in the first trimester. We need to we need to see what the prescription from the gynecologist is, if they have a running condition, if they have any kind of like, you know, borderline sugar, or if in case, you know, what the blood pressure is not controlled enough. So with those patients, we don't really invite them over more. We tell them to wait until you're in your second trimester. We might give you some cocktails after that.
What about weight loss? Because there is...
I know, that's an important one.
That is something that I'm sure everyone's would want to
asking
know.
me for that, So I would say I would actually add 2 treatments to it. I will talk about the IV cocktails, plus also I will talk about the lipolytic injections that we offer with it, right? So what happens?
And these are injections going to a specific
that is targeting. Those are like targeted areas where we have stubborn fats. Fat pockets are made, right? Which is like mostly with females, where they have like, you know, under double chin, the bra bulges, the side thighs, or maybe like after you deliver, you have like a lower belly pooch, right? So what happens is that initially we start giving you IV. IV for like, you know, boosting your metabolism. So people actually say it's actually like, you know, cutting down your weight, but it's not cutting down your weight. It's actually increasing your metabolism, which gives you a lot of energy, which gives you a lot of, so when a lot of energy is being produced, your fat cells are being targeted, right? So if your metabolism is actually increased, your fat, the stored fat, is actually in play then.
One thing that confuses me, if your metabolism increases, does it make you more hungry?
So it makes you more hungry because your fat cells are being depleted.
Right. But then, so then how do you counter that? So what happens is that initially what happens is that if in case your metabolism rate is really slow, it's very slow. So you keep eating, you have your fat stores already. You have it already, right? Every person has their fat stores for like the days when you're starving. When you keep eating and eating and eating, the fat stores kind of get more and more, like it actually increases in size, right? So when we boost your metabolism, what happens is that you're eating your food and you're utilizing that fat. You're utilizing the fat. Also, you might be utilizing a little of the fat stores also, because your metabolism is so quick that it needs more and more energy. So when you would be eating what you are eating already. It's not that you start eating more. It's not going to like increase your appetite. It's not going to increase your appetite. It's actually going to give you an energy boost, right? So your when your metabolism kind of increases, your ATP, which is actually the main energy symbol in our body, it kind of increases. That enzyme, when it increases, it needs more fat to get dissolved, so it can give more energy to the body. So what happens is that it is cutting down on all the fat that you're utilizing, plus a little from the fat stores. Little by little from the fat stores. Because the thing is that if I actually say that, okay, fine, listen, tomorrow your metabolism will start increasing. This doesn't really mean that tomorrow you're going to start eat more, right? You will eat exactly what you eat. You don't have to cut down on what you're eating. You don't have to go up on what you're eating, right? But what it's doing inside your body is it's bringing in all the fat stores and utilizing that for the increased metabolism that you have. So it's basically not the ingestion of the food, it's basically cutting down on the fat stores. So there's L-carnitine, which is like, you know, the basic component that we actually add to the solution, which increases your metabolism rate. It gives you an energy boost, and it's actually called a fat burner. So people actually use it when they're working out a lot. They're going to the gym, they're actually working out because they want to cut down on the fat and they want to build their muscle. So they're using different strategies together. That's interesting.
People
and
use
the injections, you said?
So those are the injections that we actually add to the cocktail. Firstly, the L-carnitine. So what happens is that I actually tell them, so let's just say a patient who has like PCOS, right, which is a very big problem for ladies. They gain weight. They're not eating enough at all. They're eating really less, but they're sitting, they're sedentary. Even if they start working out, they can't lose weight. They even gain weight with water. That's what the complaint is always. Doctor, even if I drink water, I'm gaining weight, right? So what I tell them is that, of course, the blood work comes into play. Let me just see what's going on, right? And let's just treat that first. And then we actually want to come down to how we can control the fat component. So IV starts burning your fat first, right? Then when they actually come down to a shape where they just like, very worried about certain parts of their body, then we target that, right?
Okay.
That I'm talking about an obese patient or maybe like a fat patient or like, or overweight patient, something like that. But let's just suppose if in case I actually have a patient who's like nice and smart, right? But she has stubborn areas or he has stubborn areas, like under the chin or maybe like, the arms, some saggy arms, a fat deposit somewhere over the belly area. Then we use a component, the lipolytic component. It is basically, the injection kind of just like targets a certain area.
Okay.
So because the thing is that, let's just suppose I don't really have any fat on my abdomen, but I have like fat on my lower belly area, right? So what we do is we mark that, we see what kind of area we need to get treated, right? And we make small boxes, right? We make small boxes because we want to target all those stubborn fat there. When we inject that there, it liquefies the fat. The fat pockets which are made, it has like a really tough membrane around it, and they won't let the fat release out of it.
Well,
right?
That's why it's so hard to
Yes,
lose
exactly. It's actually there, and they've actually like, that's it's their home. I would say like, that fat pocket becomes their home, the fat storage area, right?
And they're really
They don't want to leave. No one wants to evacuate their home, right? So they actually kind of just like very territorial about that area. So what we do is like we can just like push them away, tell them you can find a better home, move out of this space now. So we inject those areas, and we tell the patient to have like a post-care at home, which is like a hot massage on that area.
Okay.
It's kind of so the downtime is like 2 days, I would say. Is first 2 days you might see a little blue bruise over the injection site. It's a very minute, I mean like people have seen insulin injections, right? It's a very small injection. So we have like pinpoint injections there. We can just like massage it. Right there then, and then it's painful for that day because the fat pockets are breaking down, right? It's a little painful, I would say. It's like, I wouldn't say painful, it stings a little. Yeah, it's sore, yeah. So what happens is that at night, you just like warm up some oil, any kind of oil, olive oil, some baby oil, whatever, right? And you can just like massage that area. And you massage it, why? Because the liquid fat you want to just evacuate it out of there. So you press it all the way. Our lymphatic system is a system where it kind of just like, drains out all the substances that you don't require in your body. So our lymphatic system comes into play. It kind of just drains out all the fat cells. And let's say I wouldn't say first session takes time. In the second session, you feel like that area is kind of like, soft and saggy, and the fat, the clumpy fat is actually kind of liquefied now. Your skin kind of feels soft at that point of time. And then by the third session, it's gone.
Wow.
It's
that
really
is something
gone.
for stubborn fat.
Stubborn fat. I mean, I have a lot of patients for like, double chin.
Right.
And so double chin can be treated with like one treatment or maybe two max, right? And people are happy. They have like a pointy chin then. There's like difference between the neck and the chin then, and they're like really happy about that. So it actually works really well. And I do tell people that, things that you want to just like beautify yourself a little more, do that. Unless you don't require a treatment, I wouldn't want to prescribe that.
That's really important, to work from the inside out.
Yes, exactly. From within out. So I mean, like, what also I would add to it, that if in case you actually work on the inside, right? And imagine if a patient comes to me and say, I really need to do like PRP of my skin, or I want to do like, maybe like fill my skin a little with like some kind of fillers. I say, let's just say if in case you can get a more youthful appearance, these fine lines and this like, fluffing lines and everything.
Without the fillers?
Without the fillers, let's just say if I boost your hydration, and if I increase your collagen and elastic production, right? And let's just suppose you get the exact vitamins that you need for like replenishing the whole rejuvenation system, right? Let's just do that. And after a month, if it doesn't affect your body, right? And if in case you don't feel the difference, maybe then I will inject you, right?
Okay.
So it actually happens in younger patients, I would say. I wouldn't say older patients, it takes time because what the cells have actually decreased a lot. In younger patients, when they actually come to me and they get the right amount of vitamins, elastin, collagen into their system, it actually creates a whole big difference.
Wow.
And then they're like, oh yeah, we really don't need it. And then I'm like, okay, see, let's just do a normal PRP. It's like very natural, just like you inject some serums into your skin, do some micro needling on your skin, and you're fine. Let's just wait another 2-3 years until I like inject your skin with some fillers.
So so you're taking away the unnecessary sort of drastic maybe procedures. You're replacing them with something that is much more you know, less
invasive, less invasive and more natural. I am more about natural things. I mean, I'm in the aesthetic industry, I would say, but I want to promote it as such where you can just like boost in things so much that it actually changes the appearance of the person.
That is so true.
I
would think that, you know, many people have this dilemma when we're talking about aesthetics and we're talking about different types of procedures. You know, to look at somebody and then see a marked difference in them, but something that doesn't actually, I mean, maybe they look better to themselves, that's a completely different debate. But somehow it doesn't sit well.
Yes, exactly.
And sometimes, you know, you think that, okay, you know what, he or she looked better before, even if they were a bit more plump, even if they were a bit, the face was round.
True.
Right now, it just doesn't look natural.
Exactly.
So I think it's the proportion and everything fitting together.
Exactly.
Instead of just an idealistic sort of, you know, measurement of, okay, the eyes should be like this, the nose should be like this, my contour should be like that.
Just like how initially we were like chatting earlier, I was telling you that not everything suits everyone.
That was so important.
That not everything suits everyone. People, there's a different trend that comes up and everyone's like, oh, it's so trendy, it's just so in, I want to do it too. I mean, like, and everyone gets into it, but it would not look the same on you because you know what, your body system, your fat proportion, your face contour, right, your hair color, everything is different, right? So if in case I'm doing a procedure for someone, it might look good on that face. Some people have like broader, like heart-shaped face, right? Some people have like round, small faces, right? They have small chins. If in case someone with a small chin wants an implant maybe, or maybe some fillers in their chin because they want a nice pointy face, because they have a round face, I would say yes to that. Why? Because it will make your face look slimmer with like really nice contour. But the chin filler is just like so in now, I want to get it done too, right? And I'd be like, you have a perfect chin. Why would you want to add to it? So they add to it and their face looks really pointy then. And it looks really unnatural, right? So it's not necessary that my best friend is getting it done. I need to get it done too.
That is so important.
You need to look at yourself. Maybe you need Botox. Maybe you have like wrinkles around your eyes, right? She's not getting it done because she doesn't need it. You need Botox, right? So you need to assess yourself first, what you really need. Then you talk to your aesthetic physician, what I need to get. She will actually tell you what exactly would fit your face, and then just follow that rather than following a trend.
That is so important.
Yes.
Is there anybody for who you know, this is contradicted, or is it safe for everybody to use? The IV?
Yes. So I would say the cons to it, I mean, like you say, there's a lot of benefits to it, right? We've talked about the benefit throughout the time. But I would say there are a few things that you need to keep in check. First, if you have any existing disease, you need to tell your physician, right? Definitely need to tell your physician. Why? Because any imbalance of any vitamin or mineral, or maybe let's say increase or decrease of any cell count in your body can be really bad for you. It's a very sensitive thing, right? So you need to be really cautious about that.
If you have an underlying health condition.
Right? Ongoing health condition, or you taking any drugs at that moment, right?
So it doesn't interfere with the medication?
It does actually interfere with the medication if in case you are on some kind of medication which is going to affect your heart, your blood pressure, or your some kind of psychic disease. I mean, like people, we actually have a lot of people who actually have body dysmorphic diseases. We try to keep them into a bracket where we want them to actually go through counseling first.
So for our viewers, could you explain what body dysmorphic syndrome
so
is?
So body dysmorphic patients are the patients they think that there's something wrong with them, but basically there's nothing wrong, right? They want to attain a certain physique, they want to attain a certain look, which may not complement them, right? Or which is actually a little unnecessary, I would say, right? And maybe they would want that in a way which is not going to be beneficial for them, and the result will not be 100% effective also. Why? Because as we said that, you know, every fashion trend is not for every person, right? So that person might have actually had this idea in her head or in his head that I want to look a certain shape, I want to have a certain contour of my face, and I want to do certain kind of difference to myself. But let's just suppose they actually come to us and we tell them that you don't need this. Let's just say you need this better, because we've been studying all this time. So we are there to give you suggestions, and the best suggestions, of course, right? Because we want to have good practice and we want to have good clients, right? They do not understand that at all. So you have to do big counseling.
Right.
Yeah.
How do you get them out of this?
Okay, so it's a very difficult thing, I would say. It's very difficult because the thing is, once the brain has decided that I want something, you cannot push them back. It's very difficult to actually, like, talk them into it again, unless you have good interactive skills and you can actually talk them out. So what matters is that if you've practiced enough to know the psyche of a patient, you get to know what exactly she or he wants, right? So what I do is, like, I would actually ask them first, what do they want and why do they want what they want, right?
Okay.
You want to understand their psyche first, right? I can't just say you don't really need it and I'm not going to do it for you. They'd be like,
Of course,
why?
yeah,
Yes, I am here to get treated, so why not?
Yeah.
So I just want to educate them first. Education is the first thing. First thing first. You can read off of the Google, you can see YouTube videos and everything, but you don't really know. I mean, like, if in case that is right for you or not. So educating them first. I would educate them first. Listen, whatever treatment you want, the downtime to it is this. I have patients who actually had this problems. That's the reason why they did this, right? And also they wanted to achieve a certain look, and the look after looked really nice, right? But the look for you is this, right? For example, if you have a small round face, right? You want to just like inject some Botox in your masseter. Your masseter muscle kind of will be decreased. You will have like a nice pointy face, right? Then again, let's just fill your chin up, right? And it's going to give you a nice contoured face. That is going to be my advice to them, right? Let's suppose they say, no, I don't want to add any fillers to it, right? But I want to add fillers to my cheeks instead, right? But what will happen? They have a round face already, right? And the cheeks will pop up even more. What would that be? It won't complement them. But they actually want like nice plump your cheeks, right? So I will say, let's just like, elongate your face a little and then add more volume to your cheeks. It will actually be a right proportion of your face. So if you make them understand, then I show them pictures, like patients that I've done before, or maybe this is the look that you want, and then this is what you will look like, right? So some patients I would say, I'll thank to Allah for, like, I have those skills where I am actually, because I have like, I was on surgery and surgery oncology before, so we have a lot of counseling sessions there. You have to make the patient understand how and when everything is supposed to be like. So I actually give them a lot of education first, and I'm glad that they kind of understand. There have been a few cases, I would say. I wouldn't say I have no cases at all. Some people are like, no, I really want it. Maybe I will actually get it done. But mostly understand. It's just by rightly educating them.
And I'm sure you have lots of patience in doing that,
yes,
especially
of course.
the way you explain things so well. Okay, so Dr. Fatima, let's go and have a little visit of your clinic here and also see some of the procedures that you're offering here, especially the IV ones, and how they work, and we look at the different serums you have.
So, sure thing.
Right?
Let's go.
Okay. So this is where you have got this infusion tray ready. And this is where you're probably going to seat the patient?
A patient, exactly.
Okay. Right.
Can we have you here? So when we have a patient come in, what we need to do is like make them really comfortable. We want to create an environment where the patient can just like relax a little. The infusion, of course, it takes like about 15-20 minutes.
Oh, so that's not long at all.
That's not long enough, right? But also depends on, what if in case a patient has like really constricted vessels, it takes maybe 30 minutes then, right? Because we need to give the infusion in a very slow process, right? We don't want to overflow it, right? Because then you have kind of like tingling sensation all over your arm.
You were mentioning before as well that you do a small test?
Yes, a small. So what happens is that we make a whole solution, right? But before we actually start putting it in, what we do is that we give them a test dose, right? We give them a small test dose to see if in case any kind of irritation, inflammation, a redness, swelling, if that appears, then we need to like stop there then and maybe like, change our regime or see if in case they're allergic to someone, right? Of course, we take that in the history, but most of the patients, not true to like what they say, right? At times they kind of miss on like some certain things that are required in their system. So what we do is that we first kind of like ask them if in case they have any kind of needle phobia as such. We ask them that, and it's a small pinch. So what we do is we have this really small cannula, which is like the butterfly cannula, right?
Yeah, that looks good.
Really small one, yes, exactly.
Especially for people who don't like cannulas.
Yeah, because the thing is that, so we have the bigger cannulas too.
Okay.
Well, those are for the patients that, you know, it's very difficult to track down their vessel, and once injected, we don't want to prick them again, right?
Right.
So if in case some people actually have a problem with their blood vessels, then we use a cannula. Other than that, the butterfly cannula works really well.
Okay.
Plus also if it's 100 ml infusion, so it goes really nicely, and it's a small prick, so it doesn't really have a bruise after, right? Then what we do is that we make a cocktail. Cocktail which is glutathione, then with some vitamin C, right? It's a 500 mg vitamin C. Then we have multivitamins, and also we have vitamin B12 complex, right? So what we do is that we make a whole complex of these things together depending on whatever the patient's requirement is. So according to those, we need to evaluate if in case they need sessions or how many sessions are required. People come in weekly, plus also the environmental side, they're like, you know, we sit there, we talk to them, we indulge them in the conversation, so it makes it really comfortable for them. So today we have a glutathione patient, and we will like to do that. It's I guess second seating for her.
Okay.
Second seating. So what happens is that you take it weekly, and then once you start the course, you need to take the course for at least 2 months, right? Weekly, right?
Okay.
And then later, after on the 3rd month, we do maintenance course, right? Right? So we actually give you like alternate, or maybe we actually give you like, you know, once a month we do that according to the patient's needs, right?
Right.
So we would evaluate how the blood vessels are.
Okay.
So we would actually prefer, we'd prefer the blood vessel which is like more evident, depending on if in case a patient
and everyone has different veins.
Different veins, exactly. So you know, you have blood vessels here, you have blood vessels here, blood vessels here, depending on which vessel is more prick friendly, right?
Right.
So if in case, and then also you can ask the patient also. So there's aesthetically, there's one problem. Aesthetically, when you ask them, there's a problem like, where do you want to get pricked, right? Because certain times there are people who say, I don't want my hand to get pricked.
Yeah.
I will wear a sleeve.
Sometimes it hurts more.
It hurts
in
more.
other places as
but
well.
I would say it's aesthetically, they say they don't really want the other person to know we've had a treatment done. There's this thing also in here in the society. So they want to see, they want to be like more like, let's just say I want it on my arm, right? I don't want it on my hand or my wrist or somewhere that it shows, because you have to have a band-aid on it later.
Right.
So that is something that we actually ask the patient, so we don't have to like, you know, focus on the fact that we want to get that pick over there.
Okay.
So we ask them, where do you want to get pricked? Yes, yeah. So you do that then, and depending on if in case there's any irritation or any kind of needle phobia, we also ask those questions too. Why? Because we have to be very careful with patients with needle phobia. I mean, like once it's pricked, then it's fine. So we take a tourniquet, right?
Right.
And we put it around here. So you need to put pressure on the vessel up top, right? If in case you have more pressure here, it actually makes the vein bulge even more, and then you actually feel it with your finger.
Right.
So you need to feel the pulse if in case it's actually, so now it's actually very evident enough.
Okay.
Right? What we do is...
And what is that you're doing?
So we add some kind of saline to the, because it comes in a powder form, right?
Okay.
So we need to dilute it first. We need to add some water to it and make it liquid soluble.
Right.
We make it liquid. Then after it's actually diluted enough, if particle is absorbed in there, then we will add it to the solution then. There we have vitamin C, which actually boosts the action of the glutathione, being also a very nice antioxidant. Plus a brightening agent. Why? Because it actually helps with the pigmentation, hyperpigmentation. Right. As you all know, everyone keeps putting vitamin C as a topical solution.
Yeah, exactly. Those are the things we're using.
Yeah, you need to use vitamin C
as well.
Yes.
Yeah.
So we add that vitamin C to this directly. And then we take the glutathione. So we calculate the doses required for the person beforehand. when we take the history for the patient.
Right.
But
and the other factors as well.
yes,
that,
exactly.
You're going to.
Yeah, but then again, if in case what the patient actually requires more, then we depend on next sessions to be held. But initially, we actually give the minimum dose required. Plus, also, if in case a patient does not have any kind of run infection or something, then there's actually an average dose that every person should be getting, depending on the actual weight of the patient.
Okay, that's how you determine.
Yes.
Right. So all those people who are queasy about needles,
yes,
need to look.
So I hope you don't have any needle phobia now. Work better.
I'm sure there'll be a time in the future when needles are a thing of the past.
Maybe, hopefully, yes. Everyone actually kind of just like,
and everyone will look back and think, oh God,
thank God, no more needles.
There were injections and needles at that time, and
Yes. So we need to be very careful that, the patient, you can just be comfortable now. The pinch, once the needle is in, then you don't really want the patient to move around a lot, because we don't want the patient to be like pricked again, right? So you have to be very careful of that. Unless if in case, other than that, you need to see if in case there's no air bubble all the way in the line. Right. In case there's any air bubble, you need to like extract it out. So we've actually done that already. There's no air bubble in there, right? Okay. And then what we do is that we're going to run it very slowly initially. Initially, run it very slow. We ask the patient if the patient has any kind of pain, discomfort. So we need to check that first.
So it's going to be monitored.
It can be monitored through, So we need to be there with the patient then. If in case they say it's fine and you don't really have any problem, then we can just like, increase the fluid level a little more.
Right.
So... So just rest back now and enjoy your session. So we'll just let this be for a while and then see if in case she has any complaints. She's had it before, so of course she's not going to have any complaint for sure. Yeah. And then definitely we'll just have a chat session with the patient. We'll just sit right next, have a good chat, and ask them if in case when they want to see us next, or if in case how productive it was since the last time then.
Right.
So we ask all the feedback then, and then of course if the patient's coming back to us, this means it's a positive feedback.
That's right.
So we're happy.
And you were talking about the patient coming inside and getting relaxed. I'm sure they feel so wonderful when they walk into the clinic because it's all so pretty.
Thank you so much.
You've decorated it so well, Dr. Fatima. Thank you so much for all your time and for explaining so much in such detail, because that was really, really important for our viewers. This is a topic that I'm sure many people would not have known about. So before we end today's program, a quick message for our viewers.
So what I would want to say is this, that first thing first, I've educated enough patients about how it is very essential to look after your health first, right? As an aesthetic physician, I would say, of course, looking beautiful is one of the trendiest, most thing, and then everyone needs to look beautiful, carry themselves really well, but beauty is what lies within, right? You need to keep a check on how your system is, what your system requires, just how you have maintenance for your cars, your housing, your cleaning and everything. This body requires maintenance, being healthy, keeping a check in what's going on in your system. If you have any kind of conditions as such, let's just work on that first and just kind of beautify yourself within, and it will definitely show on the outside. So eat well, rest well, take your nutrition properly, keep the calories in check, and also keep your vitamins and minerals in check. And after that, if in case that's not working, then we're here to give you all the topical techniques that may be required for beautifying you even more.
That's fantastic. Yes. Thank you so much.
Thank you.
Thank you. And as Dr. Fatima said, beauty is that lies within. Yes. So let's take that as our take home for today. And that's all we have time for, unfortunately, until next week. Stay happy, stay healthy. Bye-bye.